Hi friends, I am Dr. Pratap Singh Rathod. I have done the MD in Forensic Medicine. In today's video, we will continue with substance dependence. In that, we will discuss about solvent abuse. Solvent abuse, which is also known as volatile substance abuse or glue sniffing, involves deliberate inhaling of variety of substances such as toluene, gasoline, xylene, benzene, chloroform, methylene, ethylene chloride, fluorocarbons, carbon tetrachloride, butane, propane, kerosene, isopropane, amyl nitride, acetone, trichloroethylene, methylene chloride, butyl nitrides, kerosene, etc. for their psychotropic and hallucinogenic properties. So these are the different form of volatile substances which are usually used for their psychotropic and hallucinogenic effects. Volatiles such as paint strippers, typewriting erasers, brush cleaners, household aerosols, fabric cleaners, gasoline and glue solvents are also misused in this. Mode of use: it may be used as huffing, where inhaling vapors from a cloth that is saturated with the volatile substance. So the cloth is like a kerchief is soaked with the substance, and the person's it is huffed. That kerchief is placed on the mouth and with the water substance and held over the near the nose and mouth, and it is inhaled. Then bagging, which refers to uh, inhaling and exhaling into the plastic bag that has been filled with small amount of water substance. So bag is filled with some water substance and continuously the inhaled and exhaled. So it is continuously inhaled and exhaled from that bag. The open end is then placed against nose and mouth, and the air is inside is breathed. Then gaseous substance. In gaseous substance are usually introduced directly into the mouth or nose from either by large cylinder or from small ampule cylinders for refilling gas cigarette lighters. Others are used directly from pressurized aerosol cans, including pain relieving sprays. So some are just inhaled directly from the spray bottles. Next is sniffing, is done by inhaling directly from the neck of the container, such as jerry cans and petrol fillers of motor vehicles. The effects vary from conditions resembling alcoholic intoxication and distortion of perception and actual hallucination. Usually the person develops some form of intoxication and then some hallucinating effect. The person feels powerful dreams, heightened sensation and detachment from reality. The sufferer often behaves totally irrationally, commits antisocial acts, and may injure or even kill himself. Later, the abuser will often have complete amnesia for the period of intoxication. Most of the abusers are young, usually male teenagers. There is no physical withdrawal syndromes are usually seen. Cause of death: major cause of death is due to sudden cardiac arrest following arrhythmia, mainly because of sudden fight or flight stimulus is developed some considerable time after sniffing and has ability to precipitate ventricular fibrillation, sudden death. Next cause of death is hypoxia or hypercapnia from persistent rebreathing and toxic effects of solvent. So, in sniffing, the person may constantly inhale or exhale inside a bag and may lead to hypercapnia and die because of hypoxia. Then plastic bag asphyxia, because he is using the plastic bag, the asphyxia may develop leading to death. Then aspiration of vomit, also one form of cause of death. Reflex cardiac arrest due to inhalation of gaseous substances. Drug injection may trigger intravascular thickening of certain hemoglobinopathies. If the person already has some hemoglobinopathies resulting in sudden death. Accidents such as fall from balcony also may occur. Coming to postmortem appearance, there may be reddening or extortion of skin around the nose and mouth from intense action of the solvent. There may be severe damage to liver, kidneys, bone marrow, and nervous system. The clothing, blood, fat, brain, and lungs should be sent for chemical examination in these cases. Blood should be collected in a Teflon lined screw top bottle, since water compounds can diffuse through the rubber. Blood samples must fill the container completely so that the solvent is not lost in the head space when the lid is removed. One lung, urine samples, unfixed tissue from liver and brain samples should be placed in nylon bags and sent for analysis. In suspected case of inhaled drugs, nasal swab should be preserved. Headspace gas chromatography is used for identifying the substance of solvent abuse. These are my references. Thank you.